course, the other impact of social media on kids is mental health. And mental health is an issue that seems to be exploding in our country. 15% of 6-year-old boys are now on the NDIS with issues mostly around autism and being neurodivergent. But a preeminent psychologist, McGorry, wrote an interesting opinion piece today where he essentially says what we're seeing is the rise of unmet need and met unneed in our mental health system. So what he means by that, the unmet need, people with serious mental illnesses like schizophrenia are not having the same access to support that they did when things like institutional care existed. Those were obviously dismantled in the 90s and nothing similar has replaced them. So people who really do need structured environments aren't getting that support. But on the flip side, people with low levels of mental illness like autism or depression and anxiety are getting a lot of support through the bloated NDIS. So what he points out is there is a really unfair mismatch in need versus support provided by our system, and it's the most vulnerable again that are paying the price. And now he says our mental health system is like an ambulance at the bottom of the cliff. There's no support to stop them jumping off that cliff.
And what he's called out is that there are people in the system now who really shouldn't be in the system. He writes in the column, rates of diagnosis of ADHD are also surging, driven in part by a welcome catch-up for historical underdiagnosis, but equally by a wave of misdiagnosis, which includes substantial met unneed. At the same time, severely disabled older adults with severe mental health illnesses are locked out of vital health and psychosocial care. And basically what he's saying is that the divide between these people has actually grown. And of course we talk about, oh, mental health is such a big issue now and we're spending more money on mental health. Well, he points out that the proportion of health funding that is spent hasn't really changed in 30 years. The numbers of people committing suicide in this country are not really moving because you have all these people coming into the system, and he points out, largely come from wealthier parts of the country who can afford to access mental health care, but in the process are clogging up the mental health system because they think they have anxiety or they think they have ADHD or they think they have depression or whatever, because they've been told that everything that they experience in their life has to be medicalised in some way as opposed to it being just, sometimes part of life. Those who need real care and could be a danger to themselves and to others cannot get it. What he is saying, and he's been on this case for a very long time, of course was Australian of the Year in 2010, is that we are just not up to scratch. We say we care about mental health. We don't care about mental health. We care about mental health being fashionable. And we have, Are You OK Day? And they give out some cupcakes in the workplace and say, oh, if you're feeling depressed, go and talk to someone. But if you have a real mental health problem and you want to get help in this country, it's nigh on impossible. Try to take yourself to a public hospital and get help for mental health. It is impossible. I know from personal experience, not me going to a hospital, but I know people who have. Like, they have gone to a hospital desperate for help and they cannot get it because we cannot provide it, because we have too many people clogging up the system and we don't spend the money where it's needs to be spent. I think it is an absolute disgrace